Well, it's great to be with you, and I'm very excited about what's happening within the Progressive MS Alliance now. Right now we have three large collaborative research networks that are bringing over 40 researchers from around the world to focus on two areas of progressive MS, discovering new treatments for progressive MS, as well as developing the tools that we need to do clinical trials faster. We have two networks that are focused on drug discovery. One is led by Dr. Francisco Quintana, and they are focusing on finding new treatments that can impact the immune system in progressive MS. They're making terrific progress. They've already identified potential candidate drug treatments, and they're starting to evaluate those for their ability to change how the immune system works in a person with progressive MS, with the goal that changing that immune system would slow the progression of the disease. In addition, the network led by Professor Gianvito Martino is also focused on developing new treatments, but their focus is on treatments that can protect the brain from damage and also stimulate myelin repair. And they also have identified a series of drug candidates that they're now testing and evaluating to move forward into the next phase of clinical trials for people with progressive MS. And underlying all of that is our goal also of developing better tools to do clinical trials faster. We all agree that it takes too long to do clinical trials in progressive MS, and people with MS, particularly progressive MS, need solutions sooner rather than later. So the network that's led by Dr. Doug Arnold is focused on developing a new kind of a tool using MRI and imaging that can detect whether or not progression is happening in a person who has progressive MS, and use that as a tool to shorten the amount of time it takes to do clinical trials. We're very excited by the progress these teams are making, and we're looking forward to bringing them together next year for their a midpoint check-in so that we can make sure that we're all on track and moving forward. We're very excited about the future. We're making good progress now, but we're not resting. Our goal is to continue to accelerate the discovery of new treatments. We're focusing on building new tools for discovering yet more drugs that we can test and evaluate in clinical trials, so that we can have more candidates that can be evaluated. And in addition, we're excited about working on even more tools to shorten the amount of time it takes to do clinical trials. Things like developing a blood test that would be very easy for a person to use as a tool for understanding whether or not their disease is progressing and whether or not a treatment can make a difference in their progress. And we're also focused on bringing forward treatments like rehabilitation, symptom management, cognition strategies to ensure that people can live well while we find these treatments that can improve their outcomes and shorten the disease.